Good morning. In this video, we are going to see about the histological features of dentin. So, first feature which we are going to see is dentinal tubules. What are dentinal tubules? Dentinal tubules are the functional unit of dentin. They are S-shaped in nature, and the marked part is the dentinal tubule. There are two types of dentin, which is a primary dentin, secondary dentin. And the primary dentin will have a regular S shape, whereas your secondary dentin will have an irregular S shape. So this feature is the S-shaped dentinal tubules. Within the dentinal tubules, your odontoblastic processes pass through. So the next feature for dentin, histological feature of dentin is dentino-enamel junction. The junction between enamel and dentin is called as dentino-enamel junction. This junction is scallop shaped. Your convexity will face towards your dentin and concavity will be towards your enamel. This will be a scallop shape where the concavity is towards the enamel and convexity is towards the dentin. And the arrow pointing in this picture shows the dentino-enamel junction. The next histological feature is the interglobular dentin. So what are interglobular dentin? Because of the failure in fusion of the globules during the mineralization process, there results in a uncalcified structure or unmineralized structure, which is your interglobular dentin. So the globules, the matrix vesicles will be there during the mineralization of dentin. During that time, there will be failure in fusion of the globules, which leads to the formation of interglobular dentin. So this feature will be viewed as black color star shaped structures under the microscope. So when viewed under the microscope, we can see the small star shaped black color structures present in between the dentinal tubules. Those structures are called as the interglobular dentin, and the dentinal tubules will pass through this interglobular dentin unmineralized structure. The dentinal tubules will pass through this interglobular dentin. The problem is only the failure in fusion of the matrix globule vesicles and not in the structure of the dentin. So thus there will be only failure in fusion of the mineralization process, which causes interglobular dentin. Under microscope, you can see it as star-shaped structures. So the last feature of dentin, histological feature of dentin, is your dead tracts. What are dead tracts? The air-filled empty spaces of the empty odontoblastic processes is called as dead tracts. So when viewed under microscope, the dead tracts will be black in color. So these are the air-filled empty spaces, air-filled empty odontoblastic processes. Dentinal tubules. The odontoblastic processes will degenerate, and thereby there will be presence of empty dentinal tubules where the air will be entrapped inside those dentinal tubules, which under the microscope it appears as dark structures. Under the light it appears as dark spaces, whereas in the reflected light it will appear as white in color. And the very important feature of dead tracts is this appears only near, most commonly this appears near the incisal tips. In posteriors it will be slightly rare, whereas in anteriors we can most commonly see the dead tracts. So the four important histological features of dentin are your S-shaped dentinal tubules, your interglobular dentins, your dead tracts, and the last one is the dentino-enamel junction. So with this we complete the histological features of dentin. Thank you.